Hi, welcome back to Rohrich Knows Podcast. I'm Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. And let's talk about this series of Ask Dr. R. These are questions I get from my staff, from my patients, and from my social media. And today we'll talk about the 10 most common facelift questions that I get from all those venues. So let's dive in. So what's the recovery time for a typical recovery time for a facelift? Usually it's 12 to 14 days. You know, you stay a minimum of 2 days with us in our hotel, which has 24/7 nurses. And then you can move either to your home or to a local facility or a hotel. And then I'll see you every 2-3 days after that for the first 2 weeks. Make sure you're doing well, especially if you've had any chemical peel or laser. You can almost add a week to that, because your redness will be more sustained, especially if you're doing a perioral peel. So, but usually it's about 2 weeks. And everything is obviously dependent on the patient. And you can resume almost all your activities at 4 weeks post-op. So you can be back doing everything. And sometimes what patients desire, and I really advocate, is they can do hyperbaric oxygen. We can begin that on day 1 or 2 post-op for about 5 days, and that really speeds up your recovery. And then the other question I get is, how long are the results, how long will they last? And will it turn my face back how many years? Well, the goal is to take off about 10, 15 years, and most patients last between 8 and 10, 12 years. The average patient I do a facelift on that I did before was about 11, 12 years. But again, it's just like a car, you know, you have to maintain it, and you got to make sure you stay out of the sun, use medical grade skincare, sunscreens, and all these non-surgical options to maintain your results. You just can't, you know, go out, drive your new car like crazy and then say, hey, it's going to be fine. You know, you need to maintain it. And I think anybody that invests so much time, energy, and money in doing this, you need to help us help you. And really, we call it the cycle of care. And we make sure that you stay in that cycle of care after surgery. And then, will my incisions be visible? And the answer is, as plastic surgeons, we make incisions so that they're almost imperceptible. But of course, every incision is always visible to a certain degree. But we tend to hide it as we make the incisions around the ear. We hide them inside the ear, around the ear, posteriorly. We really want to make sure that they look almost imperceptible. So you can obviously wear your hair up and do all those things that we want you to do and enjoy them. And they should be almost imperceptible, you know, at 4 to 6 weeks. And sometimes it's less and sometimes it's longer. It's amazing. You know? I saw one of my patients today that was 4 weeks out and you could barely see her incisions. So a lot of it is your genetics as well. So, and here's a question I get all the time. And they say, am I ready for my facelift? What is my ideal age? Usually when a patient comes in and they're in their early 40s and they're saying that, they're there because they really think they're ready. Remember, it's a want, not a need. So the ideal age depends. I mean, I like to do patients that are, ideal age, it'd be late 40s, early 50s. That's the ideal age, because then you'll look great for a long, long time. The earlier you do a facelift, the younger you do it, the better you'll look and the longer it'll last. So I actually love that age, 40s, late 40s, early 50s. That gives you the more powerful result and a better result than somebody that's in their late 60s or 70s. Not that that's not a bad time to do it, but it just gives you one that makes you look sustainably youthful. And here's a very popular social media one. What's the difference between a deep plane facelift and a smash facelift? And I will tell you that deep plane facelift is not new. I know it's new on social media, and neither is the smash facelift. These are all deep layer facelifts. That's the most important thing. The epiphany for any facial rejuvenation surgery should be, it should be far more than skin deep. It needs to be deep multi-planar facelifts, where you're lifting the deep layers of the face, and the smash is a deep layer of the face. And you can go deep in the face, but you can't go much deeper, certainly in certain parts of the face, than the smash. Now, you can go further out in the face and go in that area, and that's really what the deep plane facelift is you're going further out and releasing ligaments. And some people will tell you that gives you a better result. But has it been shown? The answer to that is absolutely not. I think the results are highly dependent upon the surgeon. Good surgeons get good results from deep layer facelifts. I think we need to all learn how to do deep layer facelifts that are safe and reproducible. So there's a fine line difference. I know people talk about how incredibly great and important it is, but they're all good in the right hands if you're competent and do safe surgery. But I can tell you, all of these can give you a good or bad result if you don't know what you're doing. So find a facelift surgeon that is excellent, that is prudent, that will take good care of you, that will do safe things and give you a great result. Better is more. A better facelift is one that does deep layer lifting and then central facial filling, hence a lift and fill facelift. So do I recommend hyperbaric oxygen for postoperative treatments? I would say yes. I've talked about it just earlier in this podcast. I actually think it speeds up wound healing. Does it make your end result better? Probably not, but I've been impressed by a lot of my patients recently that have gone to the hyperbaric chamber for 3, 5, 7 treatments, that there speeds up their wound healing significantly. So I think that's significant because it does penetrate deeper and allows your tissue to heal faster. So I think the answer to that is I like it, and I think it's got some evolving science that make it show that at least early on you can heal faster. This is a good question. I'm afraid to do a full facelift. What is the difference between a mini facelift and a full facelift? Well, I get that not infrequently. I don't know what a mini facelift is. Is it done by mini surgeons, or I don't know, because a mini facelift has so many ramifications. Does it mean a little incision, a little undermining? I basically don't do a mini facelift surgery. I think you either need a facelift, you would benefit from a facelift or not. A mini facelift to me means that you're really not doing much. Now, sometimes in a patient that's had 2, 3 different facelifts and they're in their more mature patients, I may do less of a full facelift. In other words, less undermining and less deeper layer. But in general, whenever somebody mentions a mini facelift, usually gives you mini results for a minimal amount of time. So I really tend to stray away from a mini facelift. So how can I best prepare for a facelift procedure? Supplements, skincare, things to avoid. Well, I think the best thing is, when you come see me, I will tell you exactly what the process will be, and I have specific preoperative supplements and vitamins that I think you can take to prepare you. We'll get you on the appropriate skincare, which is the retinols, antioxidants, and sunscreens, all those things to prepare your skin before surgery. And of course, the things to avoid, and there's a long list of things, but the most important ones are, the aspirin, Advil, Motrin, fish oils, all these things that actually will tend to cause more bleeding and bruising post-op. And there's a whole litany of those things. So yes, you can prepare yourself, and luckily it may take months when I see you to have your procedure. These are all the things we prep you for, getting you an appropriate skincare regimen, getting you to the right supplements. So know before you go, and this will give you the optimize your chance for getting a great result. And a question I get also not infrequently is, how long does a facelift procedure take, and is it safe to do multiple procedures at the same time? Well, this is an answer that says it really means depends, and it's really a several-part procedure, because in general, I just usually don't do a facelift because I usually do a face and eyes and sometimes brow, but I also will do a skin resurfacing. So it is safe to do multiple procedures, in this head and neck area. I infrequently do other procedures outside of that area, especially if I'm doing multiple procedures, face, eyes, brow, laser, and sometimes a rhinoplasty. That's enough, because you want to do it in a time period that's safe and optimal for the patient. All my patients are done under general. So make sure it's something that's done, obviously, in a safe time period, somebody who's healthy. You have good anesthesia. I'm lucky to have phenomenal anesthesiologists that are have been with me for years and years. So I know the routine. I have the same OR team. So I'm a very efficient surgeon. So I do all these things very concomitantly. But usually if you do the face and eyes and a laser resurfacing with or without a rhinoplasty, that is optimal, and it gives you, I think, an optimal result because it gives you a great useful look to your eyes, your brow, and your face. When can I travel, fly home? When can I have sex? Well, I think those are the answers are a little bit different for those two types of questions. So usually I have patients, most of my patients come from around the world, and I usually let them go home in about 12 to 14 days. They can fly in 12 or 14 days. The sutures are out by 10, 12 days. I'll let them fly back to Europe or wherever they're from or other parts of the U.S. But they can't exercise for about 4 weeks. And I usually have a FaceTime with them in 2 weeks. But I usually have a lot of postoperative care regimens. So we do facial massages and a series that begin right after the sutures are out. And we do hydrofacials and broad-based lights. So we really help them optimize their shape and contour and minimize their bruising. So that's that. But as far as having sex post-op, I think it should be at least a 4-week time period. And I can tell you that if you don't do it, if you do it much sooner than that, you can have significant issues, including hematomas and things that are not very well, that really can not help you. So I would say please wait and abstain for at least 4 weeks post-op. So I think these are all great questions. I think the biggest thing about facial rejuvenation is find a surgeon that is an expert in science of aging, understands it, is an excellent surgeon that does a significant amount of facial rejuvenation surgery. That look at their website, look at their social media, and make sure their patients look normal and don't look weird or different. Because again, we are in the face protection, not witness protection program in plastic surgery. So know before you go, and hopefully these have answered your questions. If we missed any questions you may have, please give me your thoughts and comments, and we'll see you at the next Rohrich Knows.